for fake pending bills. Direct accounting services, who may be responsible? What then would be the independence, functional independence of the internal auditor when made the secretary to the chief officer, made secretary to the direct accounting services in terms of verifying the accuracy and completeness of pending bills? You'll just end up with, it'll just be a lab for manufacturing and laundering pending bills. There is a problem here, Governor. So I think we have demonstrated enough of it. We might just want to ask you to do one or two things so that when we come to Kilifi, we can have a better conversation, because I think you have seen where the gaps are. Please go and review this so that when you are presenting pending bills, even you as a governor, you've got a good feeling that it is verifiable and it is accurate. But you need to look at those internal reassignments, because they might conflict the objective you have as a CEO of the county.
Thank you, Chair. And I have just a committee which I gazetted, and I've just completed to look into all those things you see in their papers, which will be reporting to me in the next few weeks. So that will be able to give me a really.
Okay. Since we have a definite date when we come to Kilifi, we can probe this further, because it's not just numbers. These are small companies. These are lives that are at stake. So maybe when we come to Kilifi, make sure that we've got a more detailed analysis of this and better responses than what we have received here.
But Chair, I'm very uncomfortable, because if pending bills worth 10.7 billion, the documents are not there. It means that these people will not be paid. So you need to really give us an indication where these documents are. If they are not within the presence of account government of Kilifi, then the suppliers should really provide.
They are, Chair.
Yeah?
There we have, provided. As I've said,
yes.
You will see there's a gazette. I did not, because it was not part of the questions, I did not bring it. I've had a pending bills committee running for the last 60 days. They have just completed their work. They have all the vouchers and pending bills with them. The last 2 months' bills were being paid after the clear document from that committee. And not only the document, but they must clear. The instructions and terms of reference from me was two things: the voucher and the really project. Pictorial, or the committee goes physically to verify before they tell Treasury to pay. So we have more details. We'll provide that, Chair, when you come.
Okay, fine. So I think the last observation here, there's something here, honorable members, that is crazy, in the sense that in the month of July 2025, Kilifi County received 4.5 billion. That is in the management response. Management response, page 8, where the governor is talking about late exchequer releases. The governor's response on page 8, where the governor explains the reasons for the pending bills. And I think it's a matter of national concern. If 4.5 billion can come in July, and the entity is expected to utilize that money within those timeframes. I don't know, today is 15th of June. You have 15 days to the end of the financial year. How much remains unremitted to Kilifi?
May and June, Chair.
And that's how much in total?
Will be 2.2 or something, thereabouts.
2.2?
Yeah.
But to the end of the financial year?
Yes.
So this one was 4.5 billion.
Chair, you'll see you have money there from conditional grants. Kilifi has a lot of that. We have the water, we have like 1.7 billion. We have royalties, 950, which was probably pending for 2 years. We have KUSAP, we have KISIP, we have FLOCA, We have all these things. So I think these guys should be able to explain all that money was for which entities.
No. I mean, it's not a problem. We are just asking ourselves, if you're given 4.5 billion in July and given 14 days to spend it, because that's the situation, isn't it?
Yeah, what happens here is...
The system is open up to 15th of July.
Yes, what happens here is some of these monies, they don't stay in the CRF. They go straight to the entities, special purpose account. If it's water, it goes to the two companies because it's indicated they have 700 million maybe for Malindi Water, 500 million for Kilifi Water. It's transferred. If it's KIPES, the money is transferred to the special account of KIPES. So it does not stay in the same account. It will be, yes.
So what Chair is saying is you must spend that money within 15 days. And what we are saying is it's very untidy the way national government is transferring cash. I thought you should agree with us. That
yes, I agree with you. Yes. We have received the money very late.
Yes, that's the issue. We are
actually,
we
received it after you people intervened, the senators intervened, that the money is... You remember there was the signing of the conditional grants, which delayed for so long. First it came to you, then it passed through you, then the president assented. It all took so long. Actually, the World Bank, the country director visited, and we had a meeting with me, with all the team of World Bank. That's why they have extended the time of completing these projects, because it was not tenable that the money came to Treasury, but they did not, for some reason, disburse those money. But I think the government, national government, managed to explain to World Bank, so they came and we adjusted all the timelines.
I think, Governor, this is a challenge we throw to you.
Yeah.
The next time the Council of Governors is meeting in Kilifi, let them make resolutions that are more useful to the nation. There is no way that you can get 25% of your money in July, and then you have to spend it in 14, 15 days. Those are far more productive issues to engage on. This amount of money is what Tharaka Nithi gets in a year. Tharaka Nithi spends that money in 365 days, and then it is sent to you to be spent in 14 days. I mean, we must hold Treasury to account. It is not, there is no, unless they are gods and angels in Kilifi. If you have to spend 4 billion in 14 days, itakulwa. So that must be the conversation. We jointly take a position and face the National Treasury head on. This is extremely untidy. 4 billion in July, and we have to spend it within 15 days.
Thank you, Chair. We'll need help from you. I know we still struggle through Council of Governors, but if the Senate committee comes in, will help us a big deal, because you can even summon Treasury.
Just to go on record is that, you know, National Treasury has been always violating Article 219, because when the money is appropriated by the Parliament, it should be released without undue delay. And I remember, Chair, I think all of us in this room, except Senator Kataya, we were in the last session, and we had to censure the former minister, Ukuri Yatani, over similar matters of delay in exchequer releases to counties. So I don't know what is the wisdom of National Treasury to delay the release of the money up to the last minute. And of course, there is the issue of now EGP. There is the issue of deadline and access through the IFMIs. So there are still many challenges with IFMIs in terms of and also control of budget.
Yeah, actually, where we spend a lot of time is the control of budget. If you see the last disbursement, it took us at least 4 weeks to be cleared everything. As I'm talking to you this morning, I was battling with my teams to make sure that the legal department of COB clears insurance for our staff. Don't forget the insurance expired. I've been negotiating with the insurance company that please don't discontinue us. But it's already 4 weeks now. The money we have in the account, but we can't pay because we are waiting for clearance.
Chairman, I mean, Governor, I thought SHA is working. Why are you taking private insurance?
And I knew that is where Ogongo Mugen would want to go. I was just waiting for
Chair.
that. I thought the governor, I think I
Chair,
can
you know
assist
the-
you, governor.
Yeah.
I thought you meant other forms of insurance like car insurance, car cover. So why is Senator Ogongo Mugen quick to run to share? And by the way, he was missing in United Opposition rallies in Western. You should have said those ones in rallies, not in this committee.
Order, members.
Chaired by the broad-based chair.
There is a substantive audit finding on irregular procurement of insurance services. I think we can have that conversation when we get to it. Now,
You know, we keep learning. I want to understand. Teachers are covered by SHA, it's working. We, day in, day out, we get serious
Chair,
queries
point of relevance.
from,
We are not discussing teachers' cover
just a
here.
minute.
no, let him just prosecute, then we will.
Yeah, you
Governor-
have been
Governor.
begging us to ask some of the questions, yet when it comes
No,
We
to
have
that,
the-
you want.
I think let's allow Senator.
We are facing this problem, including where I come from, Nyamira, where you find we are paying a lot of money to SHA to cover employees working within the county government. And again, you are paying a lot of money to private insurance companies. Notice, I think we had a big issue is from Nandi, audit query. So I want to really understand, how do we progress as a country? When I was in the health committee last time, we had said if we have a universal health coverage, more money will be paid to that entity so that it's liquid to support universal health coverage. Now, with this idea of counties opting for private insurance, how do we reconcile?
Now, Governor, let's just to make sure that we are still relevant and in the audit, let's just examine that under irregular procurement of insurance services.
Thank you, Chair.
I think that's under lawfulness. It's the first paragraph on lawfulness and effectiveness in the use of public resources. Auditor General, so that it's not a hypothetical conversation. We can see how much Kilifi is spending on insurance and whether there could have been better value for money if it was done through a state insurance scheme.
Thank you, Chair. Irregular procurement of insurance services. Management engaged an insurance firm to provide medical services, medical insurance at a cost of Kenya shillings 398,331,861 per year through a contract signed on 27th January 2023 to run from March 2023 to 29th February 2024 with an option of renewing the contract by the client subject to an internal performance review by the client's representative, and a notice to renew shall be served to the service provider not later than 1 month preceding the end date. A new contract agreement was signed on March 2024 for a period of 1 year until 28th February 2025 with an option of renewal by the client subject to an internal performance review by the client representative, and a notice to renew shall be served to the service provider not later than 1 month preceding the end date. The contract was again renewed for a period of 2 months from 4th March 2025 to 4th May 2025 at a cost of Kenya shillings 79,666,373 through an addendum agreement dated 25th February 2025. However, based on the contract sum for the last 2 years, the prorated cost of the 2 months is Kenya shillings 66,338,643, resulting to an explained variance of Kenya shillings 13,277,730. This was contrary to Section 139, Subsection 2, Subsection A of the Public Procurement and Asset Procurement Disposal Act, which states that an accounting officer of a procuring entity, on recommendation of an evaluation committee, may approve a variation of a contract which shall be accompanied by a certificate from the tenderer making a justification for such cost extension of the contract period. In the circumstances, management was in breach of the law. Thank you, Chair.
Okay, Governor, Your response?
Thank you, Chair. Chair, the county government of Kilifi did a fresh tender advertisement for the medical insurance services on the 18th day of February 2025. On the 25th day of February 2025, the county government of Kilifi received a complaint from an advocate on material governance issues to be addressed. On the strength of the complaint, a consideration for termination was initiated and the tender was ultimately cancelled on the 10th day of March 2025 following an advisory letter reference number PPRA stroke MSA stroke 5 stroke 10 volume .171 dated the 7th day of March 2025 from the Public Procurement Regulatory Authority. To avoid the risk of exposure of our staff and their dependents from non-coverage of medical insurance owing to procurement procedural delays, the accounting officer extended the contract with the service provider for a period of 2 months, pursuant to the recommendations from the Contracts Implementation Committee following a meeting held on the 25th day of February 2025. Further, the premiums for the 2-month extension were higher than the proported amount, since members had fully access to their full benefits for the 2 months, and the benefits could not be prorated. A risk premium of 20% was charged to cater for the members who might have assessed fully cover limits within the 2 months. Attaching hours of the 2nd day of March 2026 at pages 700 to 719 as appendix number 22 are minutes of the Contract Implementation Committee dated the 25th day of February 2025, authorizing extension of the contract to the accounting officer. To request letter by the county government of Kilifi for extension of the medical contract for 2 months, dated the 25th day of February 2025. Acceptance letter by the medical insurance cover provider for the extension of the contract from the service provider, stating the additional 20% risk premium, dated the 26th date of February 2025. Quotation for premiums from the service provider for the 2 months extension. Minutes of the Contract Implementation Committee dated 27th day of February 2025. Acceptance letter by the county government of Kilifi of the quotation of premiums dated the 28th day of February 2025. Letter referenced KCG PSM PO 2024/2025/volume 1 /07 and date the 18th day of March 2025 by the county government of Kilifi to the Director General, the Public Procurement Regulatory Authority. Letter reference EKA PPRA 006/006 and dated the 25th day of February 2025 by the law firm of Onindo and Associates Advocates to the Director General, the Public Procurement Regulatory Authority. Advisory letter reference PPRA MCA 5 MSA 5 10 volume 1 71 and dated the 7th day of March 2025 from the Public Procurement Regulatory Authority. Thank you, Chair.
Auditor General.
Thank you, Chair. Based on the client's response, the query was asking for 2 things. One was on approval for the variation of the contract, the procedure that is applied, and a recommendation from the Evaluation Tender Committee. Those documentation are not within the documents attached, and that was the basis of the query. So in terms of the response, the management was still in breach of the law. Thank you, Chair.
Governor, you have given a very elaborate response. Why can't it be supported by documentary evidence?
I don't know what time when we have tendencies sometimes here, which I always try to run on my officers, that the time they get the documents most of the time is when the auditors either have exited or whatever, but we have said we'll do it differently. We have been in communication with the AOG that during the entry and exit, when I'm there myself, I'll be able to get in between what they are looking and they are missing so that it's provided for. But in the meantime, Chair, if you allow us, we'll provide this to the AOG, ASP, as soon as possible.
It's not part of the annexures you have here, because I'm going through your Appendix 22.
I think the variation was not part of. There's some documents, but the variation I don't think is there.
Okay, so if it's not here, then the matter is still open. Now we might then ponder on the question raised by Senator Okongo Mogeni. You are spending 400 million a year on staff medical insurance. Can this not be provided through the Social Health Authority if they've got an institutional cover?
Chair, unless we engage, I know when we were in National Assembly at one time we engaged in NHIF. Unless we engage, because you realize that the